discover how to heal multiple diseases with cannabis in today's episode with Dr. Joseph Rosado. He is a medical doctor specializing in plant-based medicine. And in Hope and Healing, Dr. Joseph Rosado lays out the plant's surprising history and controversy and the challenges that physicians face when recommending it and the benefits his thousands of patients have enjoyed from its proper use. So, Dr. Joseph, please tell us how cannabis can help to heal certain diseases. Heal Podcast with Lily Patrascu shares longevity and anti-aging techniques to stay young forever, increase energy, overcome addiction, and live your longest, best life ever, shared by world's most innovative, alternative, and traditional health thought leaders, healers, and doctors. Discover quantum healing strategies to heal your mind, body, and soul.
Excellent question. So I'll answer the question with a question. And that question that I'm going to ask you and those that are watching and listening is, are you aware or do you believe that we produce cannabis in our bodies?
No, I'm not aware.
Do you believe that is true?
I have no idea. I have no knowledge.
Okay, so good answer. But the answer is yes, we do produce our own cannabis. We have the capability of producing cannabis in our bodies. All vertebrates, for that matter, have the capability of producing cannabis. That is why it is called the endocannabinoid system. We all have a system that produces cannabis. And by producing this cannabis, it works on the receptors where the cannabis works on. This was discovered in the early 1990s. The first endocannabinoid was discovered and named in 1992. And it was called anandamide, which comes from the Sanskrit word ananda, which means bliss. Since then, 4 other endocannabinoids have been named have been discovered and named, but the 2 most frequently discussed are anandamide, which I have just mentioned, and 2-AG. Therefore, as we age or as we have dis-ease, lack of ease, our endocannabinoid capabilities drop. And so we are no longer producing the amounts that we are accustomed to producing. And for that reason, we need cannabis from the outside in, or phytocannabinoids. Phyto meaning plant, cannabinoid meaning that it works on the cannabinoid receptors, and these phytocannabinoids now work on those receptors, replenishing, recovering what the body no longer produces to maintain what we call in science homeostasis, also known as balance, maintaining a balance or an equilibrium within our bodies.
Thank you. So, is cannabis addictive? I have never tried. And if yes, what can people do to prevent that from happening? And what kind of diseases can it help heal?
Okay, so to answer your first question, no, there is no addiction formed by the use of cannabis. People can create a dependency, a psychological dependency, but compared to alcohol, cocaine, opiates, even cigarettes, it's not the same type of dependence. With those substances I just mentioned, your body creates what's called a physiological dependence, which leads to addiction. By physiological, it means that your body becomes addicted to not only the way it makes them feel, but they become addicted to what that drug does in their body. And so they become addicted to the chemical physiologically. With cannabis, they become dependent on how the medicine makes them feel, but not necessarily on the actual chemical in their body, which explains why somebody can stop using cannabis today and be perfectly fine and not go through the withdrawals or the cravings that occur when somebody stops using alcohol or cigarettes or heroin or cocaine, etc. As far as conditions or diseases that can be linked to the use of cannabis, for health healing. In the state of Florida, for example, we have rules, and the rules or laws are such that there are 10 conditions where people are automatically qualified to receive medical cannabis. Those are post-traumatic stress disorder, PTSD, cancer, any type of cancer, epilepsy or seizures, HIV, AIDS, glaucoma, Crohn's disease, multiple sclerosis, Lou Gehrig's or ALS, and the 10th one will come to me. But of those conditions, or beyond those conditions, we also have a rule that says any chronically debilitating condition that is equal to or greater in severity than one of the ones mentioned also qualifies. So, for example, I did not mention depression, I did not mention anxiety, but those two conditions I can put under the umbrella of PTSD, post-traumatic stress disorder. Or if somebody says they have irritable bowel syndrome or ulcerative colitis, then I can put them under the Crohn's disease umbrella.
Thank you. So tell us how entrepreneurs and people, I guess, can leverage cannabis to heal. What is the procedure? Is it some cannabis oil, or what is it? Because I've never had any. So what how do you actually use it?
There are multiple ways of using it. Most people only know of or think of two ways. One being smoking, and the other is, like you just said, oils. The older population always comes in and wants to know about gummies, edibles. So those three are modes of administration, but there are others. So the most commonly utilized is inhalation in the form of smoking, but not only smoking, but also people can use an extracted oil, put it in a cartridge, and inhale it that way, kind of like an electronic cigarette. But there are other ways of being able to inhale it. There are nasal sprays that I utilize a lot on children, my special needs children, my children with epilepsy or autism, that when they're having a meltdown or on the verge of having a seizure, they are able to squirt the medicine directly into their nose, and it goes right into the receptors in their brain, and it helps control and address the seizure or the meltdown that comes with autism. There is what's called a metered dose inhaler that looks just like an asthma inhaler. So what asthmatics use to treat their asthma, you can get your cannabis that way as well. All that falls under the umbrella of inhalation. Okay. Next is oil under the tongue. The challenge with the oil under the tongue is that it takes 30 to 90 minutes before you feel the effect, but it lasts 4 to 6 hours in your system. With inhalation, you get the effect within 3 to 10 minutes, but it lasts 2 to 4 hours. The next is in the form of a topical cream or a lotion or an oil where you apply it directly onto your skin. So if somebody's having, let's say, nerve pain because they are a diabetic, or they have had chemotherapy because of their cancer, then they have severe nerve pain, or they had or have HIV and they are on a specific medicine that causes nerve pain, they can apply this oil directly onto their skin or a patch that controls pain. Another way of using it is in the form of an edible or a gummy or a cookie or a brownie. The biggest challenge with that is that it can take 2 to 3 hours for one to feel the effect, but it can be in your system anywhere between 6 and 12 hours, depending on how one metabolizes. And the last way of using it is in the form of a suppository. The benefit of the suppository is that it bypasses the liver. It does not get metabolized in the liver, similar to inhalation. And so if somebody has cancer in the liver or they have issues with their liver, they are able to receive the medicine and not have an adverse or a drug-drug interaction.
Thank you. So why does cannabis work for all of these diseases? And how long does it take to actually notice like a big improvement in the condition?
Okay. How quickly it works in the system depends on how one metabolizes. Okay. And but usually, for example, if somebody is having pain, an example is one of my long-term friends of mine, I met her when she was 5, I was 15. Her mother was my supervisor. She has a condition called rheumatoid arthritis. And for over 20 years, she was in constant chronic pain because of that condition, because of the inflammation caused by this disease. The moment that she inhaled the cannabis, within minutes, she was 100% pain free. And she immediately called me up crying in tears because it was the first time in 20 years that she was not in pain. So as quickly as 3 minutes, she had the situation under control. Same thing with people that suffer with or from migraine headaches, or people that are on the verge of having a panic attack or major anxiety. They do an inhalation and it stops it immediately. And so that's how quickly it can work. As far as the healing process, well, that takes a while. For example, certain phytocannabinoids have the capability of shrinking tumors. So if somebody has cancer, for example, it's going to take a certain amount of time for that tumor to be able to shrink. And once the tumor shrinks, then they are, in essence, quote unquote, cancer free. Now, granted, many of my patients continue to use conventional medicines. They use the cannabis as an alternative or in conjunction with what they presently are using. And together, they have found that it works much better for them rather than one or the other. I always encourage my patients to utilize both.
Thank you. Why does cannabis work for healing multiple diseases?
The reason cannabis works for the healing process of multiple conditions and diseases is because the endocannabinoid system is located within every organ system in the body. When people take anatomy or physiology, they learn and know about the reproductive system, the respiratory system, the cardiac or cardiovascular system. They know about every one of those systems. But we are not taught about the endocannabinoid system. Less than 10% of medical schools in the United States, and I would venture to say the world, learn about the endocannabinoid system and how cannabinoids work to heal the body. So within each one of the systems, there are cannabinoid receptors. And by there being cannabinoid receptors in every organ system, that is how and why cannabis is instrumental in working on these receptors to be able to restore balance and, as a result, restore the person's health.
Thank you. How can you work with patients to help them heal or you can say reduce their multiple diseases?
First and foremost is we do, just like any doctor's visit, we do a patient history. We obtain a history. We do a physical examination. We review the medications that they are on, what they've used, what they've not used, how they've responded to the things that they have used. And then based on their experience in using cannabis or lack of experience, that will dictate what I recommend and how I recommend it. Also, aside from the phytocannabinoids, there are other substances that are also found not only in the cannabis plant, but all plants in the plant world. And those are called terpenes. Terpenes are what give the plants the smell and, in the case of cannabis, the taste. So, for example, linalool is found in lavender. That is excellent to manage and treat people with insomnia and anxiety. Pinene, alpha pinene, is found in pine needles. It gives the smell of pine. That is excellent to address and manage patients with chronic pain. Individuals with gastrointestinal issues, problems with their digestion. There's limonene, which is found in citrus. And that also helps to alleviate and control issues in their stomach. So now what we're doing is using what's called the entourage effect, which is an effect that utilizes the terpenes plus also the phytocannabinoids to work together in conjunction to allow for the body to receive the greatest benefit, and as a result have reduction in symptomatology and eventually healing. I can't hear you. You're muted.
How can entrepreneurs find you?
Very easy. Go to my website, josephrosadomd.com. That's josephrosadomd.com. And on my website are all of the links to all of my social media platforms. I also have a YouTube channel. On YouTube, I have multiple interviews that I've done, as well as presentations that I've done all over the world.
Thank you. Is there anything else you would like entrepreneurs to know about how to heal with cannabis?
Absolutely. Whenever I complete an interview or sign my book, because I've published 7 different books on the topic, the first being the one that you mentioned, Hope and Healing, The Case for Cannabis, all of which are available on Amazon, as well as my website. But it is hashtag Cannabis is Medicine. People want to claim and say that cannabis is a gateway drug. In reality, cannabis is really an exit drug. It is an exit to addiction. It is an exit to being dependent on medications that have greater side effects than the actual disease that the people are living and dealing with.
Thank you. Follow me for more interviews with world's most innovative health change makers to live your healthiest life ever.